we are going to move from a country level perspective to a more regional perspective with Dr. Abdias Dougnon, who is the Regional Coordinator for Health and Nutrition, ICCM, for West and Central Africa for Action Against Hunger. And he will discuss the journey of implementing community-based nutrition programs. Over to you, Abdias.
Oui, merci Kevin et merci
Kevin.
MSF
And thank you MSF for having invited us and giving us the opportunity to talk about severe acute malnutrition as managed by community health worker. We've called this program ICCM Plus. So why did we decide to include severe acute malnutrition in our package? Well, it's because millions of children are wasted every year, and less than 40% of these kids are treated. And in order to have access to a health structure, we know that there are obstacles, which could be money, which could be the distance, and also other difficulties hindering access to healthcare. So we rely on community health worker to improve the management of severe acute malnutrition in these settings while preserving the effectiveness of this type of problem. So we have adjusted our programs in some countries, and I'd like to thank Salimata, who's already prepared the ground for my presentation. We had a pilot study first to assess the efficacy and also the cost-benefit and efficacy ratio, and we also wanted to assess the coverage. The first pilot study was run from 2014 to 2016 in Kita, Mali, where we noticed that the results were very good in terms of efficacy and coverage.
Nous avons après testé les traitements dans d'autres contextes, notamment
the treatment in other settings in Mayari, in Niger, and in Gidi Marca in Mauritania. And for these last two, it was from 2016 to 2018. Then we decided to scale up to further assess the efficacy of this strategy from 2017 to 2019 in Mali, and then in the Gidi-Maka region in Mauritania from 2019 to 2020, and we are still scaling up in some health districts in Mayari, Bouza, and Madawa in Niger. And we've also adapted our program in some areas with a simplified protocol with the ICCM Plus study in Gao, Mali from 2019 to 2021, so as to test this simplified protocol and the Compass protocol compared with the standard protocol, and first in Mali, and also in Niger, in Difa, and around Lake Chad, and for the period 2020-2022 in Hodel Chagi in Mauritania.
Donc, j'aimerais rapidement vous présenter quelques résultats.
Briefly, I'd like to present the findings of these pilot studies. From 2014 to 2016 in Mali, for the areas covered, we have integrated malnutrition with community health workers, and we wanted to meet the indicators as defined by the WHO. And what we've noticed in this area is that there's an increase of the coverage. It was almost doubled at the end of the study. And we found out that this approach was very efficient for families because it helped them save time and save money they would spend less money on health concerns. Then
La seconde étude, la
the
phase
second pilot study, the second phase of the pilot study in Mali, that is the one where we scaled up, that is the study that Salimata has reported about. Then we can skip there for this one. And this is what we have found in Niger in the 2017-2019 period. We noticed that in this area,
de la prise en charge dans les paquets
thanks to the integration of nutrition in these ICCM under the responsibility of the community health worker, there was also an improvement.
Et c'est le même constat et pour
Same finding, same conclusion in Mauritania.
L'intervention a permis de garder l'efficacité.
We could demonstrate the efficacy of this management while respecting the sphere standards of WHO. The lessons learned from these studies and the practices to be implemented thanks to these conclusions has shown that governments have bought in this new strategy. Before that, we had a steering committee under the umbrella of the MOH and the nutrition program. And locally, we have enjoyed the support of researchers who've adjusted our actions to the settings, researchers who've committed to treat malnutrition with innovative methods. So these are the lessons we've learned throughout the pilot studies. Now, the strong points and the benefits of this approach. It helps to ensure a continuum of care for children with SAM, severe acute malnutrition. And we think also that the community health workers have an impact also to cover other diseases, that is malaria, diarrhea, plus SAM. And it helps to foster coordination and partnership with the MOH, as well as the local community that is involved. And the whole package was entrusted to the community health workers. It also did have an impact on the coverage, treatment coverage, that is, and we have achieved results such that we've doubled the coverage after our initiatives. And also, we've maintained and sustained the quality of care while complying with the sphere standards.
Donc l'intervention est vraiment efficace, surtout pour les ménages.
Cost efficacy ratio is a benefit for the families because
sont dans la communauté, donc ce qui est vraiment
when the community health workers are at the center of the community, it reduces the cost for the households. And
à réduire considérablement. Slide.
Their health costs covered by the families has decreased. Now, there are some limitations also to be reported. There was a need for a strong involvement of the ACF teams to supervise the community health workers. So there was a very close cooperation, close supervision on top of the supervision and monitoring done by the MOH nurses and the MOH authorities.
Extrapoler les résultats de l'étude dans d'autres contextes. Donc,
it will be difficult to extrapolate the result of such study to other settings. So you really need to get prepared before implementation. We've also
de malnutrition aiguë sévère qui était uniquement
a bias, which is that it was only severe acute malnutritions that were managed by the community health workers. Now, as to make this ICCM plus approach operational, As you've understood, we've scaled up this approach. But in order to scale up a program, you have to make sure that there's already an ICCM in the country. And in order to support these approaches, we need to make tools available, tools to identify and plan the program, particularly when you are in unstable settings. And we've also had to develop training modules, online training modules, mainly because of the pandemic. We have had to ensure that there would be training provided remotely in both French and English. And these training modules had to be adjusted to the COVID pandemic and to the simplified protocol. And we've also made sure that all the data would be collected on the COBO system. And we've also made sure that there were tools to supervise, as well as a supervision and monitoring strategy. Now, the challenges to make ICCM Plus operational is supply to the health community health centers, because you're talking large volume of supplies. So ACF had to carry out a study to assess the volumes to be shipped and supplied. We've also noticed that in some instances, the community health workers were not paid. They had no wages for that. So we needed to have a driver to have an incentive for them. And then to scale up the program, you realize that you need to get well prepared in terms of resources, equipment supply, and training, and then supervision. Recommendations that we could make from this experience is that for those who would like to go for an ICCM Plus with a simplified protocol, you have to ensure proper coordination with the local operators and players at all levels and adjust the supervision to the specific needs or to and the setting and or to the community health worker. ICCM Plus is really a plus when you integrate it for the management of severe acute malnutrition. Thank you for your attention.
Thank you very much, Abdias. Before we get to the next session, there's a question from the audience that's particularly relevant for you, Abdias. So does this ICCM Plus approach increase the workload dramatically for community health workers?
Merci pour cette.
Thank you for this question.
When
we had our pilot study in 2014-2016 in Mali, we realized that adding severe acute malnutrition in the package did not significantly increase the workload of the community health workers. They are more comfortable with the prevention measures than new curative actions. And I think we have published a paper about that. You can see that on the ACF stand in the exhibition, in the virtual exhibition room.